Hey everyone, welcome to the Trippy Coaching Podcast. I'm your friend Andrea Trippy, weight loss and confidence coach, along with the amazing Tommy Else, personal trainer. I'm super excited to introduce someone who's not just a brilliant doctor, but also a great friend of mine, Dr. Mike Drzewiecki from the Neurologic Wellness Institute in Wooddale, Illinois. So let me tell you a bit about Dr. Mike in a way that's easy to digest. He's a doctor of chiropractic and a specialist in functional neurology, which is a fancy way of saying he's amazing at helping people with neurological issues. He's got this prestigious Diplomate Degree in Chiropractic Neurology, Functional Neurology, and he is one of the few people in Illinois with a fellowship from the American Board of Brain Injury and Rehabilitation. Plus, he's certified Chiropractic Sports Physician. Dr. Mike's real passion is helping patients regain their quality of life. He's traveled all over the world consulting on some of the toughest neurological cases and has treated athletes from the professional level all the way down to high school. His journey in this field started under the mentorship of Dr. Frederick Carrick, and he's been involved in some truly life-changing cases. For example, he helped a young girl with severe POTS symptoms regain her ability to walk. That's when he knew he was hooked in this field for life. A bit of personal background information on Dr. Mike is that he was born in Houston, Texas, grew up in Grand Blanc, Michigan, and he's got a business administration degree from the University of Michigan Flint, and he went on to earn his Doctor of Chiropractic and Master's degree in Sports Health Science from Life University in Atlanta, Georgia. When he's not busy changing lives, Dr. Mike loves playing hockey, staying fit, and spending time with his family. He's just an all-around awesome guy, and I am thrilled to have him on the podcast today. So without further ado, let's dive into our conversation with Dr. Mike Drzewiecki.
The Trippy Coaching Podcast is sponsored by Hairborn Salon, welcoming its newest member, Crystal. With 15 years of experience, enthusiasm, and leadership in the men's grooming industry, Crystal joins the Hairborn family with the ability to provide their gentlemen with all of the services they need, from cuts, color, beard details, and even waxing. Crystal has trained others in the field for 10 years and works to grow her knowledge and expertise with continued studies to learn the newest and latest products, trends, and skills. She uses her passion and talents for fine arts and creative arts to fuel her hair artistry. Together, you and Crystal will not only create your individual style, but she will teach you how to maintain it so you can walk with a renewed confidence every day. Be sure to mention that you heard about Crystal and Hairborn Salon from the Trippy Coaching Podcast to receive 10% off your next service. And you can book your appointment at hairbornsalon.com.
Dr. Mike, welcome to the show. We are so honored to have you. How are you?
I'm doing great. Thank you so much for having me.
Yeah, definitely.
Yes, nice to meet you. I've heard a lot about you.
Thank you. Thank you.
Dr. Mike, could you give us an overview of the Neurologic Wellness Institute and your role there?
Sure. Yep. So I am the clinic director there. So oversee all the day-to-day operations along with my partner, Dr. George Michaelopoulos. Dr. George has been in practice for 35-ish years. He's been doing more of the neuro side or more of the specialty in the neuroscience, clinical neuroscience side for the last probably about 15 years or so, give or take. He had a traditional chiropractic practice to begin with, and then transitioned that to a neurology or neuro-based practice probably about 15 years ago. And then I came on, myself and my wife, Dr. Christy, came up about 8 years ago. And yeah, actually, I think it was 8 years in July. So we came up, we were living in Atlanta and came up. But it's primarily a chiropractic practice. We have physical therapists there. And it's kind of half of the office is more of the traditional chiropractic type stuff. So neck pain, back pain, PT type things that are let's say hip replacement type stuff or chronic back pain, things like that, massage therapy. But then the majority of what the office does is neuro rehab. So we see It's patients that are dealing with complex neuro cases, and that can be all kinds of things. Usually it's people who have been from, anywhere between 10 to 30 doctors before coming in to seeing us, and they're dealing with complicated things that are a little outside of the box. They don't quite fit the box. They're still struggling with their symptoms. They maybe have gone the traditional route and are not seeing the success that they want, or any success, whatever it might be, and then they come in to see us. And that's the majority of what we do. I'm in the Wooddale office, and then also I oversee. We have an office in downtown Chicago, and the office in Chicago. We have another one in Boca Raton, Florida, and then another one up in Waukesha, Wisconsin. And all of those offices, it's all primarily the neuro rehab type treatment. So the one in Wooddale is a little bit unique in that we also have the traditional chiropractic, massage, PT side of things, but all the other offices are primarily the neuro rehab side of things.
Yeah.
Yep.
Your institute really does take a really unique approach to neurology. How does that differ from the traditional neurologist or MD?
Yeah. So it's in a traditional neurologist role. What the patient will come in with a neuro some sort of condition. Let's say that's MS, or it's a stroke, or it's something like POTS. We see a lot of POTS or concussion type things. They go in and they're very good at diagnosing it. Medical neurologists, of course, are amazing at diagnosing neurological conditions, and then they refer out to, let's say, speech therapist or physical therapist or some sort of rehab, typically, or they give them medications or whatever it might be. The difference is what we do is we go through a lot of the similar diagnostic things. I would say even more so. It's our initial exam is about 3 hours long, includes about an hour and a half of specific diagnosis.
Wow.
Or diagnostics, looking at eye movements and balance and cognition. So it's pretty extensive. We look at that and then go through the diagnosis part, but then do all of the rehab in our office. So whereas a traditional medical neurology is then going to refer out to different specialties, we do all of that in-house, and the same person that does the initial exam, so let's say me, for example, I am then also the one that day-to-day basis is going through the rehab with the patient too. And so then I have my eyes on them, and I can change and be dynamic with their treatment as the day-to-day changes, as compared to sending them out somewhere and then they go through rehab, to vestibular rehab or visual rehab, whatever it might be, and then 6 weeks later touch back in or something like that. I see the patient every single day, so I can change and adapt to their condition as they go along.
That's great because you're part of the process every step of the way, and so you know what's happening, and it's not this back and forth.
Yep.
I did want a quick question. POTS.
Yep.
I've seen the acronym. What does it stand for? What is it?
Yeah. POTS is postural orthostatic tachycardia syndrome. That's the long version. That's what it stands for. But it is basically where we have what's called the autonomic system, our autonomic nervous system. It controls all the automatic functions of our body. So you look at blood pressure, heart rate, sweating, pupil size. That autonomic system is what you feel is activated when somebody, you walk around a corner and somebody jumps and scares you, and
Sure.
you feel that jump, and then that kind of like surge through your body and your pupils dilate and all that. What happened right there is your autonomic system was triggered right into a fight or flight response, and that's a normal thing that should happen. With POTS, what you have is that autonomic system isn't functioning how it should. So your normal automatic functions, like controlling your heart rate and controlling blood pressure, things like that, doesn't work how it should. So if you go from, specifically with POTS, you go from lying down to standing up. Just normally, like we have this water bottle here, normally if you tip a water bottle on its side and you flip it up, all the water goes to the bottom of the water bottle because of gravity. That same thing happens for us for the blood in our body.
Sure, yeah.
We go from lying down, it's very easy for blood to go to our head. As soon as we go to standing up, gravity is going to pull all that blood out of our head, and we have to have this very fine-tuned, very fast system, our autonomic system, to change tension on blood vessels in your neck and change your heart rate and change blood pressure, all this stuff.
To adjust for all that.
To try to keep the blood up in your head. And people who have POTS, that system lags. It's slow. It doesn't work how it should. So I'm sure you guys have all felt it. You know, when you laying down, you stand up too quick and you go, whoo. And
Yeah.
you kinda
It's
get
all
that,
black and
all
like
yeah,
stars.
Yeah, you kind of get that star. And then like it adjusts and you go, oh, well, that was weird. And it was a couple seconds and then off you go and that's it. With POTS, it doesn't change. So they stand up and they have that same feeling and it might be all day long. It's until they lay down again, right? So they get nauseous, they get dizzy, headaches. You know, some people feel like they're going to pass out, lightheaded, all of that stuff. It's basically that same feeling, but it's just ongoing. And there's many causes for POTS. We see it a lot with people who are post-concussion. We see it, there's genetic components that can lead to dysautonomia, especially for, you know, it's like mom had it, grandma had it, aunts had it. You know, that's the kind of genetic one. I've seen it post-viral. It's getting a lot of notoriety now, post-COVID, long-haul COVID type stuff. I see a lot of that where it's like a post-viral type POTS. So a lot of different causes, but that's basically what it is.
Okay.
Is dysregulation of that automatic system. Yeah.
Sounds rough. Yeah.
It's a really tough one, and especially treating it is really, really hard. You look at traditional treatments of it, and it's like eat more salt, drink more water, exercise more. Usually by the time people come in and see us, they're already beyond all of that. They're like, I can't even stand up from the couch, let alone
Go to the
exercise
gym.
or do something.
Does it happen every time that they're on their back and then they get up? Does it usually happen every time?
Yeah, and that's how it's actually diagnosed is we look at their heart rate in different positions, lying, seated, standing, and look at their blood pressure in different positions, and it's a repeatable thing. It has to be repeatable for it to be diagnosed, but it's a repeatable thing that every time they stand up, they have these symptoms, and it can be pretty debilitating. It's really tough.
I presented to your Neurologic Wellness Institute with Bell's palsy. So one day I was sitting in front of a client and he looked at me with this inquisitive look on his face, like just kept staring at me. I said, "What's going on?" He goes, "The left side of your face looks like you just had a stroke." And I knew that it was Bell's palsy because of the experience I had. I had it once before after Olivia. And the time with Olivia, I wasn't able to take any traditional medicine approach. They wanted to give me some prednisone. They wanted to give me all this medicine and viral medicine, and I wouldn't take it because I was breastfeeding. So I went to a regular doctor, the emergency room, and they hooked me up with a neurologist, and they gave me the prednisone. They did not give me the viral, was that Veltrex, the viral medicine? They did not give me that. I thought for sure that this was going to last 2 weeks, right? Because I was able to have the medicine this time. I still have it. It's been over a year. So I went to Dr. Mike through referral of some really great friends, and he has treated me incredibly. Your whole team is just fantastic.
And I've noticed a difference. I tell you, when I see you, you know, a week or two goes by and I can see it's getting better.
It's getting better, which is so positive to hear. So, Dr. Mike, I'm giving you the full carte blanche to talk about my treatment and what I presented with and all of that and how we approached my...
Yeah, absolutely. I think you said something that is super important for people to know, too, is that if you kind of went through this before, or you already went through it before, you know, was it 18 years ago or so when you had Olivia, and so you already knew what it was. But for a lot of people, if you're like your client sitting across from somebody and all of a sudden the side of their face looks like they're having a stroke, it's best to assume that that's what's going on, right? Like the Bell's palsy is severe by itself, but way less severe than a stroke, of course. So if anybody ever sees somebody who their face all of a sudden is not working, or you look in the mirror yourself and you're like, oh, the one side of my face isn't working, it's like that's an immediate call, go to the emergency room, 911 type thing, because if it is a stroke, which is, there are ways to tell the difference between Bell's palsy and stroke, and that's a medical professional is going to be able to do that. But for the layperson, you can't really tell, and minutes are super important if you are having a stroke, right? Absolutely. So that's one thing. So that is super important. But for your case, that Bell's palsy, like you said, there's different causes for it. So there can be, for some people, a lot of people, it's like a post-viral type thing. That's pretty common. Sometimes post-bacterial. It can be post-injury. For some people, I've seen it post-head injury, post-concussion, Bell's palsy. Yours, it seemed like it was really hard to connect the dots exactly on this, of course, but you had, I believe, did you say you had, was it a flu vaccine? Was it with Olivia, and that caused the right side of your face?
The one and only time I had a flu vaccine, it caused the right side of my face to
to have the Bell's
True.
palsy on that side. And then this was post-COVID, and then the post-COVID vaccine shortly after, then you had it on the left side. So it's really hard to exactly point fingers at that, but you look at timeline and you look at your history of, you had one flu vaccine and you had Bell's palsy on the right side, one COVID vaccine, you have Bell's palsy on the left side. So you can kind of connect those dots there. But you had it, it was just under a year, right? When you finally, you came in, and most times with Bell's palsy, after they give it about 3 months, usually about 3 months is if they're expecting it to spontaneously resolve, it's kind of going to do that. And I say spontaneously, usually that's with prednisone, usually it's with antiviral, things like that. But if it's going to resolve, usually it's within 3 months. Anything after that, they kind of go, it may not, this might be permanent type thing. And you came in to see me, it was well after the 3 months mark. So when we talked about all that, it was like, I don't know if we're going to make a change with this, because there might be, timeline wise, there might be permanence to this. But like I do with all of my patients that come in, because like I said, I see a lot of really complicated people who have been all over. I don't tend to put limitations on people right away, because I've seen some crazy things in my career already of people who are told they're never going to walk again, and all of a sudden after a short period of time they're walking, and so many times like that, and you go, okay, just because you came in with your face and it had improved, it had been slowly improving a little bit, but it was still not where you wanted it to be, and it was after the 3 month mark we go, okay, we're going to really try like crazy to stimulate that nerve. And it's what Bell's palsy is it's a paralysis of that cranial nerve 7, the facial nerve. And that facial nerve has branches that kind of come out through the middle of your face, almost like equal with your nose, and then branches that go up in your forehead and down behind your ear, and then down and into your lips and chin and all of that. And it stops almost exactly midline. So that's kind of the craziest thing with this, is that it's like if you were to split one half of your face on one side, there's perfect muscle movement, and then you split the other side and it's paralysis. The muscles aren't moving at all. So the gravity is basically pulling down on the skin and the muscles, and that's what you see. So that's what the injury is, or that's what the condition is, for people who are not familiar with it. But it's basically a full drooping of the left side of your face is what you're dealing with. You came in, it was really hard for you to close your eye, your left eye. When you blink, and a normal blink, we all see people normally blink and we don't think about it, but when you see somebody who has Bell's palsy, that they blink and their one eye stays open, and you catch it right away. And then you smile, or even just at rest, and you can tell that there's a drooping to the one side. And there definitely was when you first came in. And some of the treatments, so we saw all that. We knew where it was from. We knew what nerve was affected. But it was interesting. We went through the exam part with you, and we started to look deeper into things. There's a lot of, and that maybe that's a little bit of a difference too, where we talked about the difference between traditional medical practice or medical neurology and some of the stuff that we do. Even though I knew, you came in, it's a Bell's palsy, it's very obvious. Some of the things that I see, like concussion and things like that, are not so obvious, but yours was obvious. We know what the problem is, but we still did the full exam. We still do all the diagnostics. We look at all these different eye movements, and we look at all these different diagnostic tests to kind of give me an idea of what parts of your brain, your whole brain, are working how they should work, and what parts are not working. And we saw that with yours, it was maybe not just the facial nerve that was affected, and there seemed to be that there was other cranial nerves that were affected too. Your tongue deviated. You had a few different, which is a different nerve. That tongue is a different nerve than the facial nerve. So we know that there was different areas that were also affected by this. You talked about some of the other things that you're dealing with too. And so we looked at all of that, and we said, okay, if there's these areas that are affected, and we can assume they're all affected by the same thing. You didn't have a head injury. You didn't have anything like that. So if they're all connected by the same cause, then we treat all of those things, and we treat all the different cranial nerves and all of that and try to get them to work together with each other. And the way we do that is through a way we're doing it with you and have been doing it, and it's been working, is basically looking at different eye movements and looking at different training different eye movements, and then training different sensory areas of your face, and using electric stimulation to these very specific parts of the nerves of your face, even using some sound sometimes, knowing that the 7th cranial nerve lives in your brainstem right next door to the 8th cranial nerve, which is where that's all of your hearing and vestibular system, your balance system, is all right there too. So doing balance training things, doing sound at the same time as doing electric stimulation onto the side of your face, to try to get all these systems to stack on top of each other, these different sensory systems, to all start to work together to see basically whatever back door or side door way we can get to try to get any information into that facial nerve nucleus, and to see if we can jumpstart it. That was basically my idea the whole way.
Yeah, it was after the diagnostic test, I was able to watch my eye movement on this video. I had googly eyes. I mean, one eye was just doing its own thing, and the other eye was doing what it was supposed to do. My hearing was affected. Remember, I was bumping into walls too. My balance was affected.
I noticed you bumping into walls just when you were over here and stuff. You
like
know.
turning a corner, I still do that though.
It was mostly like going around a corner. You like brush up against it kind of thing. Yeah.
Yeah, we noticed all of those things. So that's where we looked at it and we said, okay, it's not just a facial nerve palsy, not just a Bell's palsy with this. It's that there was other areas affected too. And you look at that. The vestibular nucleus, which is that 8th cranial nerve, and where that goes to, that tells you it's your main balance center, but it also is the foundation for all of the rest of the sensory information that comes in to tell you where you're at in space and where space is around you and all that. And if that's off or it's damaged, it's not working well, then you're going to do that. You're going to trip, stumble, bump into things. You know, for you, I know it was regularly bumping into things on one side of your body compared to the other, and we were able to tease all those things out. And then that's where I can take a look at it through that whole long exam process and connect the dots and say, okay, can we then use like I was saying earlier, the parts of your brain that are working well to then try to rehab all these other areas through different modalities, and to get them to all start to speak the same language again. And then lo and behold, we start to see the changes in that facial nerve, and you start to feel twitches. I know that's a big thing that you say a lot, is that you feel the twitches in the side of your face, and that's almost like it's like your first sign that there's like life coming back to that nerve. And that's exactly what's going on. It's waking up. It's taking some time, but it's actually coming back to life. It's actually kind of waking up and healing. That's really what's going on with it.
It's really cool, actually. I love hearing about this stuff, and especially like the approach and the plan and the method of how it all comes together and stuff. So that's pretty neat.
And you know what's cool is that push-ups aren't just for your body, they're for your eyes too.
Yeah, right.
Dr. Mike has me doing eye push-ups, so my googly eyes are no longer googly.
Yeah, that's exactly. Yeah, we talked about that. Yeah, so there are the different eye movement things that we were doing. The bead string things, right? The bead string exercise, and basically laughing and calling those push-ups. So it's essentially what they were. They're push-ups for your eyeballs. But all of that, and we do a lot of vestibular rehab, visual rehab, physical rehab, and we do it all together at the same time, like I said, stacking it all on top of each other. And we think that's why we see the changes that we see. Is it's not just go do this one area with this specialist, go do this with another specialist, this with another specialist. We kind of stack all those things together. And so even though you have facial nerve palsy, a Bell's palsy, we're doing all kinds of things with your eyes and with your balance. And generally speaking, people will be like, well, we know that there's nerve damage to this one very specific nerve in your face. Why would you be doing all of these other things? And it's that the sensory information coming in and the ability to rehab all those other areas then helps with the actual damage of the nerve that you had. And you're a testament to it that it's actually working. It shouldn't work, right? You were long past the time that your nerve should come back after having the initial onset of it. And we're seeing that it is exponentially getting better and better, and we're doing all these other things at the same time. And I think that's why it's actually working.
With my personal training clients, kind of have like a similar approach in that, like, I never say never, you know, it's like you said, you know, are the odds against you? Yes.
Sure.
But, you know, you see stuff over the years, and you never know. and it's always worth at least taking a shot. But what I really love about everything you're saying is I love all of the in-house. I love that this is like a one-stop place where you're going and being treated, and everybody's on the same page and in communication with each other. That's the best kind of a doctor in medicine that I can imagine. I like that a lot.
I got to tell you, as a patient, that they're great. I mean, from Dr. Mike to Dr. George, always saying hi, to Selena, Claire, Kristen, the girls at the front, Dana and Emily. I mean, everybody. They're fantastic. They all seem to know what's going on too. I see you guys typing on the iPads or tablets or something. So everybody's up to date, real time.
Yeah.
Everybody's, it's fantastic. You've had some great success with me, and right away I saw improvement after working with him. Tell us about some other success stories that you've had.
Yeah. Well, I guess I can. We see so much. I'm super. I have to say that I'm very fortunate in the people that I learned from. So there's countless names. There's some of my mentors, Dr. Ted Carrick, who's started all of this functional neurology idea and where I learned so much from, and Dr. Nate Kaiser, Dr. Mark Ellis, Dr. Jim Duffy. There's a whole list of people that I learned from, and I have been fortunate enough to see some really hard conditions over several years or many years and seen them get better. We take care of a lot of concussions, and these people who have had head injuries, severe traumatic brain injuries, and people call them mild traumatic brain injuries, but the concussions that can be completely debilitating to people's everyday life. And we see those changes, and sometimes it's people who have been dealing with concussion issues for 9, 10, 15 years, and they still have it. They are on disability, they can't work, whatever it might be, and all of a sudden their dizziness goes away, or their debilitating headaches that they have every day, those go away. Blurred vision, double vision, things like that, the stuff that goes along with concussion that we see vanish, and they've been dealing with it for years, and we see that all the time. We were talking about POTS earlier. That is another big component of our office. We see a lot of people with POTS and dysautonomia. Dysautonomia is like the umbrella term for your autonomic system not working, and see a lot of changes with that. And people who have been told, like I said, just drink more water, exercise more.
Right.
Lay down when you don't feel good, and people are like, I've been doing that for years now, right? And then we start to change that autonomic system through the same rehab process or similar rehab process that we're doing with you, but specific to their condition.
Right.
And you see changes where all of a sudden, there was just a girl this last week that she's been released from care. She was in for 12, 14 visits, I think it was. And before coming in, she had spent the 9 prior days in the hospital, in the emergency room, back and forth because of massive heart rate spikes and panic attacks, and her blood pressure was bottoming out, and she couldn't essentially move off her couch type thing, and it was really bad. And now she's back to living her life. She's a dog trainer, training dogs. She's back to what she said the other day was that she feels better than she did prior to her onset of POTS, which is pretty wild. So we seeing changes in people who have POTS and where they can get back. Seeing people who have severe pain syndromes, we see a lot of that where it's neurologically based pain syndromes, where we typically look at pain as you have a tissue injury, say you sprain your ankle or something like that, and then it hurts, and it's like, okay, obviously, and then you fix the tissue, you heal the tissue, and the pain goes away. Sometimes with people, that pain signal gets just perpetuated over and over again, and then all of a sudden the tissue is healed, and their brain still thinks that they're in pain. And we see that a lot too with these long-standing pain syndromes that we make go away too, and that's life-changing for people when they no longer feel blowtorch type pain on their foot or something like that, which is what they feel all the time, and we make that go away. And they go back to a young girl, she goes back to high school and playing sports and doing things like that when you have this terrible pain type stuff that goes away. So I have to say that I'm very fortunate in seeing it keeps my job fun and interesting and entertaining, because it's like every patient is a new puzzle to try to figure out. And I like the ones that come in that have, they joke and say, I've been everywhere. What are you going to, you're not going to be able to fix me. And it's like, watch me.
Challenge
Right,
accepted.
challenge accepted. And of course, everyone has their varying degrees of success, but it is why I keep doing what I'm doing, because like when you can start to see people come out of it. You start to see people getting better. The one thing that I always find interesting, it's much easier typically with women than it is with men, of course, but that all of a sudden when I start to see like they're coming in dressed up or not wearing pajamas, right? Or makeup is starting to go back on, hair is starting to get done, all that.
Sure,
It's like,
yeah.
those are the signs. It's like, I already know that somebody is on their way up without them even telling me. And you can start to see people come out of these funks where they're literally not getting off their couch because of whatever they're dealing with.
Oh, I'm sure their energy completely shifts. For
Yeah,
sure.
and then it brings up your confidence and all that. But
100%.
yeah, well, I'm sure it's extremely gratifying. When I kind of have the same thing with my personal training clients, and that every single one I get, it's like this is a new code to crack. Whether it's their exercise or their diet or whatever, I'm going to have to figure out, because everybody's different, and that's the fun part, And well, the fun part really is when you figured it out.
Like I said, that is the fun part. The stressful part is the ones that are really hard, right? When you're banging your head against the wall trying to figure out, because like I said, a lot of these people who come in are pretty complicated and have many different factors. But then when those are even more gratifying, right? When you start to see the changes in those people, and I've had many of those, and it's those are cool.
Yeah, you're treating the root cause, and
Right.
you're training the root cause, and I'm
Right.
coaching the root cause, and that's when I think everything actually kicks in and works.
Yeah.
There's no Band-Aid over anything.
Yeah, and then you're making long-term changes in the same way with physical training and all of that is and the coaching stuff, right? If you're actually fixing what is going on and you're making the problem go away, then that long-term, you see those long-term changes as compared to a Band-Aid or a medication, and medications can be fantastic for certain things,
Right.
but a medication that's just like, okay, well, this is just going to cover your pain. It's like, I want to try to figure out how I can make that pain go away so that you can, and even some of the medications, right? It's like a pain medication, but they can't drive because of the type of medication. It's like, well, let's try to figure out how we can make the pain go away. One, so you can get off your medication, or you do it because it doesn't make you feel good, but then also so you can drive your kids around or whatever that might be.
It's a
too.
quality of life thing it comes down to.
100%.
Yeah, for sure. Okay, so I want to switch gears to brain health.
Yeah.
And can you give our listeners some essential strategies that you recommend for maintaining good brain health?
Yeah, and I know we've kind of talked about this even in the office, but there are some very simple things, and there's stuff that we all kind of know, and it's like, yeah, duh, right? Like, but it's like some simple things. You look at like, okay, properly hydrating. Everyone's like, oh yeah, I should drink more water. Yeah, it's a very simple thing, but our brain is made up mostly of water, right? And dehydration, when that takes place, is not just dehydrating your body. You're actually dehydrating your brain. You lose the physical volume of your brain when you're dehydrated to a certain extent, and that affects all of the functions of your brain, right? So there's a lot of people that I talk to, and I'm shocked with it. Where you say, "Oh, how much water do you drink on a day?" And they're like, "Well, I mean,
a bottle."
Or like I mean I drink coffee, and then I have juice, and then I have I have a Diet Coke, and it's like, well, that's fluid. There's fluid, but it's not water, right? And there's so many people, even people like, oh yeah, I drink a lot of water, and you're like, okay, how many ounces? And they're like, 30, 40 ounces. You're like, okay, you need to double that or more, right? There's it's the general rule of thumb is 50% of your body weight in ounces at minimum. Sometimes, up to 75% of your body weight in ounces is, and you look at most people and they're like, I'm nowhere close to that, right? So that's a simple one. It's just drinking water, right? So the other simple things, right? Like you look at, I'm sure stuff that you're very familiar with is reducing sugar load. And for the longest time, I think it's getting more and more popular now, which is good. I think there's change in literature, there's change in all kinds of other podcasts and things that you listen to, and people just talking, that sugar is really not good for us. It is pro-inflammatory. You even look at the newest thought process and research in Alzheimer's is looking at it as type 3 diabetes, where it's a sugar problem problem, and that it's a blood sugar issue 30 years prior to the onset of the first symptom. So these are important things. You look at like, okay, is sugar problematic for me right now? Maybe not. Maybe it is. For a lot of people it is. But when you look at, okay, if I have this much sugar over 30 years and then all of a sudden I can't remember anything that's going on because I have Alzheimer's, that's a brain problem, right? So you look at reducing sugar load and everything in moderation, of course, right? Like you want a dessert or you want something like that,
Sure.
then you have it. You have that. But you look at, like I was saying, the people who have, drinking, I talk to some people and it's like 3 and 4 Cokes a day or Pops a day, whatever it is. And you're like, that's so much sugar. If you were to take
so
that
much
and,
sugar.
Ridiculous.
and put that in actual, like, take the sugar grams, and we don't work in grams, so you look at it and you're like, oh, it's this many grams of sugar. And, if you were to actually like pour that out and see it, you're like,
It's sickening.
It's a massive amount of sugar.
And you know what? We always talk about reducing your sugar load, and people do it, but they only equate it to losing weight.
Mm-hmm.
What Dr. Mike is saying is that after a long period of time, you're going to get diabetes, you're going to get Alzheimer's, possibly, I shouldn't say you're going to.
Well, sure, right.
But you have the propensity to get that with all that excess sugar in your blood.
Yeah,
it's not just about weight loss.
And you'd be shocked with some of the other symptoms too. How many people I have that have brain fog, right? It's
Sure.
like where they feel like they're in an actual visual fog, or they just can't think, or they kind of like, I feel like I'm hungover all the time, but I'm not hungover. I don't drink or whatever it might be, but they have this mental fog. And then we really clean up their diet, and we take them off of the simple carbohydrate type things, and lower their simple grain consumption and general sugar load, and all of a sudden that brain fog lifts, and you're like, yeah, it was this chronic inflammation type thing that was causing brain problems for you.
What do you say about the sugars from, say, fruits and vegetables? So like if somebody's if they're taking in high levels of that type of sugar, can that still have the same effect as, say, the Cokes and Pepsis and stuff?
Sure, it is. It's a different type of sugar, so
Right.
that fructose fruit sugar. What's really interesting is I was actually out in LA at a brain conference this year. One teacher out there was talking about, they had research that they were presenting on fructose, fruit sugar, so things like that, and omega-3 consumption, and that it was wild, the research on that actually supplementing with omega-3s reduces the harmful load of what fructose does on you. And they were connecting fructose with brain inflammation and even with Alzheimer's and things like that. Not to say that, of course, I don't want that to be misconstrued that like you can't eat strawberries because it's going to cut. No, that's not what it is. But you look at high fructose corn syrup and you look at things like that, which is a massive load of fructose, and that actually supplementing with high quality, high dose omega-3 fatty acids actually reduces the load on your system from fructose. So it's if you're going to have fruit, there's benefit, or if you're going to have sugar, having fruit sugar is better. You get fiber with that typically and stuff like that too. So you have some offloading things as compared to just straight like cane syrup or whatever. Yeah. I don't specifically build dietary programs for people to say like this is the amount of grams you should get. I'm not doing that. I'm looking at it more of when I'm going through dietary things with people, I'm looking at food sensitivity. So we do blood food sensitivity tests. We take those things out. I give them general recommendations on like let's say a paleo type diet. I do different diets or I call them diets. I hate that term, but like lifestyle, eating lifestyle choices. For different people. There's some people that I have that have significant autoimmune conditions where it's like carnivore diet. Carnivore eating is going to be the best thing for them, and they feel amazing on it. And their inflammation goes up.
For that specific person.
For that person, right? And then there's other people where it's more of like a paleo type idea where you're really trying to cut down sugar and dairy and things like that. There's other people that are athletes where I have them on a little bit of a higher carb type mentality because they're burning through more of it, right? So it's different for every person, but I don't sit down and say, okay, this is how many grams of protein, this is how many grams of carbs and things like that. One of the other big things, so we're talking about the dietary stuff, we're talking about water. Sleep is huge, of course, right? Recovery, it's really the time that your brain recovers is when you're sleeping. Getting adequate sleep, it is a little different for everybody, but anybody who's like, oh, I can run on 6 hours of sleep, no, you're just, you're kicking the can down the road, right? It's like 7 to 8 hours is really what you're looking for. Sometimes people need 9. So sleep is super beneficial. The biggest thing is movement. And you look at the stuff that we do in our office, and there's A lot of it is it's physical rehab based, so a lot of it is movement based, even if that movement is just with your eyes or a little bit with your body and things like that. But generally speaking, one of the best things you can do for your brain is to move. And it's different for everybody. Sometimes people need really high intensity movement. Sometimes people need simple movement, walking, right? I mean, there's so many people that it's like, hey, you just need to walk. I need you to walk 10,000 steps a day, and that's it. It doesn't have to be at a high pace. I just need you to move. Sometimes it's more, people need more stimulating things, but it's really anything. It's riding a bike. It's some people love, myself, I love CrossFit. That's what, I guess actually a little, anecdotal story for me, and I think maybe I know it resonates with some people I've talked to that are in especially the business world and things like that, is that, let's see, I was doing CrossFit when I was living in Atlanta. I did it for a couple years. Then I moved up here and went for about 4 years. I partnered in our office, and it's like work got crazy, right? It was one of those things where my career was really starting to take off. All focus went on work. All focus went on being a good employee at first, and then being a good partner, all of a sudden being a good boss, all of those things. So it was like 100% of my energy was going into work. It was all day, every day. And because of that, the working out started to fall off, right? I went from working out 3 to 4 days a week to down to like once every 2 weeks, once a week type thing like that. And would still move and walk and things like that, but just not at the intensity I was. And it all of a sudden 4 years went past, and it was like that. And I was like, work was going great, but all of a sudden I was heavier than I'd ever been. I was not feeling good, not sleeping. I mean, I was sleeping okay, but not like I was before. And I didn't even realize it until I think afterwards, but I think I was starting to get anxious, and I guess I didn't realize it. I didn't recognize that that's what it was, because I didn't feel anxious, I guess. But it was then my wife for Christmas got me a membership, or like a trial membership to the CrossFit gym that's by us. And she's like, I know you love this down in Atlanta. I know you've talked about it. You've kicked it around. Like, just go do it. Do it for a month. And then she knew that was like a
forever.
A
forever gift.
Yeah. I wasn't going to be getting out of the gym anytime soon. But then I started, and it was wild because I did that month, and it was like, yep, signed up for all the rest. And then I've been going. That was 4 years ago, and I've been going 3 days a week, and to the CrossFit gym religiously. And it's wild that after a couple months, all of a sudden it was like, that's when I noticed that I was anxious, because all of a sudden I wasn't. Yeah. And I was like, oh, well, this is weird. I didn't think I was anxious, but all of a sudden now I'm definitely not. And what was interesting is I was spending all this time on work and digging myself deeper into the hole, and then I was like, okay, I have to take another hour out of my mornings. I had to start working out in the morning, take more time away from, let's say, sleep, and more time away from work and all that stuff. Not patient hours, but just notes and all those things. And it was wild how taking that extra time away, all of a sudden I became more efficient. I became more clear-headed. I became more, I think, probably easier to get along with. All of those things. It was like the movement and the intensity and getting up and doing the hard thing. I love CrossFit. That's what I enjoy doing. So it's like the hardest part of my day is getting beat up in the morning before I go to work type thing.
But there's that initial fear that, like, well, if I take this hour off, I'm going to lose productivity
100%.
Because I'm not getting this done, I'm not getting that done. But it turns out that by going and giving this time to yourself and re-energizing yourself, getting that anxiety out of your system through working out. I mean, I need to work out in the morning every day just before I get my day started, just so I can clear my head. So I totally get it.
Yep.
But you worry that, am I going to lose productivity, when in the long run it actually amped everything up.
I became way more productive.
Yeah.
All of a sudden I could think easier, and it was like ideas were coming faster, and all of that. It was just, I didn't realize what kind of like mental fog I had gotten myself into over the years. And it was it wasn't like it wasn't like you hit your head and all of a sudden everything's foggy type thing. It was a slow slide. And then now it's what I need to do. And it's now I can say it for myself, but I've been preaching that for patients all along, and then seeing the changes with me. And then also I think one of the biggest things too was I had my blood work done, and as part of getting my blood work done, I also had my I checked my own vitals, or had somebody in our office check my vitals, and my blood pressure was through the roof, and I didn't know it. I didn't know. I was like, I had no idea because I wasn't checking it, and my blood pressure is through the roof. I did actually, right at the same time I started that, I did a carnivore eating for about 7 weeks, and that kind of started the ball rolling, and then jumped right into the working out hard, and blood pressure came down, blood work normalized. My most recent blood work that I just had done few weeks ago is perfect across the board. Blood pressure is good,
Awesome.
Heart rate's good, all that stuff. And
The high
it's
blood
crazy.
pressure probably made you feel anxious.
Yeah, probably,
Yeah.
probably, and it definitely did so when I actually recognized that it was high, because I didn't feel, you
Yeah,
don't feel
right.
that, so definitely made my wife anxious
Yeah.
after finding out that my blood pressure is that high.
Sure.
She's like, here's your gift.
Yeah, seriously. So
Any supplements that you would recommend that somebody takes on a daily basis for good brain health?
yeah, and that's a good question. It's different for everybody. The general ones, you look at like a multivitamin, and there's arguments against that, because people are like, oh, it's just expensive pee. It's like, you can just get it from your diet or whatever. And it's like, yeah, if you were eating a perfect diet, it's hard pressed to find somebody who's eating an absolutely perfect balanced diet, right?
Yeah.
So supplementing with a high quality multivitamin, and I have a couple different ones that I recommend there that are true high quality ones. A little bit more pricey, more pricey than you're going to find just kind of at the whatever store it is. But that's a big one. You look at omega-3 fatty acids. We kind of talked about that earlier, and that's another big one for your brain. That's huge. The other one too, and even from a physical training, personal training standpoint, creatine monohydrate is a big deal. So most of the research on creatine is in the physical realm, looking at bodybuilders, weightlifters, athletes, things like that. I recommend creatine to, I'm not going to say all my patients, but to a huge amount of them, because we utilize way more creatine in our brain than we do anywhere else. We just have way more muscle than we have brain. So everyone thinks of it from a muscle standpoint, but it is an energy producing molecule in your brain. And that's why people like it in their muscles, because it feels like you have more energy in your muscles, and you do because of the creatine. But we utilize way more of it in our brain. So when you look at cognitive functions, even some of my kiddos with some speech issues and things like that, you start to onboard creatine, and that gets way better. So
Let me ask you a quick question on creatine. So coming up, I knew guys who I think they were probably overloading on the creatine, causing them kidney issues, raising their creatinine levels. Would you say like it would be like something you would do on a daily basis and just kind of leave it at that? I mean, because there's a loading process.
Yep.
So like the first few weeks, you're taking in your doses. I think they're a little higher in the beginning just to kind of lay the groundwork for it, and then you're on like a maintenance after that. Do you recommend cycling this?
Yeah, it's a very good question. It's something that's brought up by a lot of my patients too. You look at the kidney thing. I was fortunate enough to learn everything I know about creatine from Dr. Joe Clark, who was at University of Cincinnati for a long time. He actually, his thesis, and then he went on to expand on that, wrote the textbook on creatine, which is pretty wild. I had no idea when I was talking to him about all this that he actually was the guy. He wrote the book on it, literally, but learned all this stuff from him. When you look at those studies that talk about kidney damage, a lot of times it's either somebody who's loading way too much. So you talk to some people who are loading 25 to 50 grams a day, which is way overkill. And then you get like stomach issues, you get diarrhea, you can get kidney things. That's at a massive dose. Some of the original studies that were done on that, or that came out saying that creatine caused kidney issues, were not quite correct. It was that your creatinine level is going to, if your creatinine level goes up and you're not supplementing with creatine, then it means that you have a kidney issue. We know that.
Okay.
If you are supplementing with creatine is going to be a byproduct of that for everybody. And so if you are supplementing with it, having a higher creatinine level is considered normal, because as long as all of your filtration rate and all of the other things are normal, your other kidney markers are normal, it's fine to have that creatinine level be up a little higher, because we know that you're supplementing with it. So there was a paper that was written on that is not quite correct and has been kind of debunked. Just taking in creatine is not going to cause kidney issues.
Okay.
taking in a massive amount, maybe.
Yeah,
just
too much
like anything.
Too much on anything.
Yeah. But there's a lot of people who are, like I said, are taking 25 to 50 grams a day, and it's just not necessary. You don't need that. Even big guys and gals.
You're gonna just pee out most of that. Is the other thing. So you're not even really absorbing all of it. So
Exactly. Yeah. So my dose that I do with everybody from a clinical standpoint, but then even some of my athletes that I take care of and all of that, is 10 grams a day for a week, and then 5 grams a day after that. And sometimes on my bigger athletes and people who are really burning through it a lot more, maybe they're doing 8 to 10 grams a day, but that's it. We're not doing, and then their loading dose would be maybe 15 or something like that. Definitely not 25, 50, nothing along those lines.
That's crazy.
Yeah. So, but yeah, most general people, even down to young people, it's about 5 grams a day as a maintenance, and 10 grams on the loading dose. And it's crazy. I take it every day.
Mm-hmm.
Long term, at that dose, you don't have to cycle it. I know that was your other question.
Yeah.
If you load it 10 grams and then 5 grams after that, you don't have to cycle on and off.
You're just set.
Yeah. The only thing with creatine, though, that you do have to, and I tell all my patients this, is that we have a feedback loop in our liver, because our liver makes creatine.
Right.
We make about 2 grams a day, give or take, for different people. When you start supplementing with it, or you're taking a high load of creatine in, your liver is going to shut off the production of it. We know that happens.
Okay.
It's not a bad thing. It's pretty well known that it takes about 3 days for your liver to kick back on with taking it. If you are taking it, if you take it, creatine, supplement it with it one day, and then don't take it, and then take it, and then don't take it, and then you're kind of doing that type of thing. Over, let's say, a month, you might end up with a net less creatine than if your liver was just making it to begin with, and then you're going backwards.
You need to be consistent with it if you're going to do it.
Yeah, if you're going to take it, then you just take it every day. You load, and then you take it every day. Throw it in a smoothie or throw it whatever.
And then if let's say you take it for like a year religiously, and then you get off of it.
Yep.
Your liver will be able to turn back on, and
100%.
It doesn't just kind of rely on.
It's not like the thyroid, where if you're taking thyroid medication and then after a while you take a thyroid medication for a long enough time that it stops the production completely. It's not like that.
Okay.
Your liver, it's well known that your liver is going to kick back on that production in about 3 days, regardless. Cool. Yep. So if you did cycle it, then you come off of it, and then whenever you're going back on, then it's another 10 gram loading dose.
Same thing.
Same thing all over.
Dr.
again.
Mike gave me that regimen for my Bell's palsy, so I've been taking it, and I feel great on it.
Yeah, and even like brain fog, attention, concentration type stuff, all those different things.
Yeah, I've read a lot of just a million different great uses that creatine has. So,
and it's simple. It's cheap, relatively speaking. It's easy to take.
You said, you could put it in your smoothie. It doesn't taste like anything really.
Yeah. Best to not take it on an empty stomach, I think, because then it can kind of go right through you type deal. But other than that, it's been studied for a long time. It's safe all the way down. I know one study that was even on. They were doing it on baby chicks that were still in the egg, and seeing the changes in the liver there, and it was safe for them too. Right. Even for pretty much everybody. Yeah.
Awesome.
Yeah.
Any other supplements? I know you have me on BDNF.
BDNF. Yeah, BDNF Essentials is by Research Nutritionals. It's a nootropic that uses various different mushrooms. So there's different mushrooms that are in there, and those are getting pretty popular now. That's a pill form of it. I know that there's other supplements that are out there that are like powders that you mix in coffee or you mix in whatever. But that's basically what that is. It's a nootropic that uses various mushrooms, and that's a good one too. So we talked about creatine, we talked about omega-3s. We talk about just a general multivitamin, those like mushroom type supplements. Those are the big ones. And then you can kind of go down the rabbit hole with all kinds of different supplements. But those are I would say a lot of the main, that's going to get the majority of general brain health type things from a supplementation standpoint.
So, Dr. Mike, I heard and have seen that you're running a marathon for charity. Could you tell us a little bit about the cause you're supporting and what motivated you to participate?
So it's the Special Olympics Chicago is the charity that I'm raising money for. I have played hockey my entire life. I played hockey and golf. That's what I did growing up. I have generally been a terrible runner. I have generally hated running for my entire life.
Same here, man.
Yeah. I have not enjoyed it. It was always something that if it was something I had to do or because I was training for something else. but have never really liked it. And I think it was because it always hurt. I'd get done with a run, even a short run, and it was like my joints hurt and all these things. And I was inspired by a few of the people that I work out with that are running marathons and have been running. And it was kind of that little thing in the back of my mind of like, you should probably just do this, right? Like check that one off the bucket list, even though I hated it. And so I went into it knowing that it wasn't something that was a strength of mine, and said, okay, I'm going to do the Chicago Marathon. That's coming up in this October. And my two goals were, one, to figure out how to train and do it all summer and not get injured, meaning like not just hurt every time I run, right? So I had to, it's been a learning process the whole way. The second goal was just finish the marathon, right? Yeah. So those are my only two goals. It wasn't a specific time or nothing like that,
Just do it.
Just do it. Yeah. Just cross the finish line. And so I reached out to a couple of good friends of mine that treat marathoners and triathletes and things like that, and was like, okay, basically, I'm running hurts all the time. What do I have to do? What do I have to do to train all year with this and for this and not end up in your office type thing? And they were able to give me some very helpful tips, and they changed my running stride. I took a course with one of my friends, Dr. Adam Wolf, who I actually wrote or helped him write a book. And he helped me with my stride, changing how I strike the ground, changing my cadence. One of my other friends who lives out in Colorado trains a lot of these people and watches gait, and he had the same thing to say, like changing your cadence and how fast your feet hit the ground, and not limiting yourself when you're striding out and hitting your heels, which is actually slowing yourself down and causing all these ground forces to go up through your joints. Yeah. And they changed my stride, and they changed all this stuff and then helped me with different thoughts on nutrition and different things like that. And it suddenly is not painful anymore.
I wish I knew that.
It's crazy.
Yeah, I'm sure that a big part of my problem is I'm just not running the right way. My heel strike could be off, my cadence and my stride and all that. I mean, who knows? But I mean, I like the second I start running, I'm waiting for it to be over. So
and that's how I was before it. And it's been the wildest thing because I changed those things, and all of a sudden it doesn't hurt anymore. All of a sudden I like doing it. Yesterday I ran 9 miles, which was the farthest I've ever run in my life. Next Saturday I have a half marathon that I'm running, and I have been feeling great. I have no pain. It's like I enjoy running. I enjoy doing this now, and it's kind of funny because I look in the mirror and I'm like, what? This is very strange because I've never like all of a sudden. But I took it as you know what? Actually, I think this is a good segue. Just quickly for what we were talking about before, different things you can do for your brain is to constantly stimulate it, right? So that's one of the things that we didn't talk about was the constant stimulation and constant learning and constant pushing your brain to learn new things. And so I went into this whole marathon training with the thought process of I'm going to do it as a learning process. I'm going to learn how to run correctly. I'm going to learn how to get fitted for the right shoes and run with the right shoes, run with the right equipment, run with the right amount of fluid, hydration, including like salt, the right amount of electrolytes, all of those things. So it's been this long learning process for me in the process of training for the marathon. And I think that constant stimulation for your brain too is so, and that could be for like learning a new language, learning a new instrument, learning whatever, a new golf swing. It doesn't matter what it is. If you're constantly stimulating your brain, and that's what I'm doing with the marathon training too, is to take it from a learning standpoint, and then your brain is constantly stimulated.
Create new grooves in the brain.
100%.
And it just gives you a different mindset. I mean, it just, you're looking forward to your runs.
Well,
I know.
Yeah. And it'll also be something that now, when you're treating people who have been through marathons and stuff, now you have that perspective of what it's like. Like for me, I had a perspective of what it's like to lose weight from doing bodybuilding competitions and having to lose 35 to 50 pounds or whatever. So I've been there. I've had to go through that, and that's something that I can then empathize with and understand the struggles that go along with that with my clients. Now, once you've gone through this whole thing, that'll be one more tool in your chest as well. So
100%.
I ran the 2009 marathon.
That's true.
And,
that's right.
My goal was just to finish and talk about pain. I mean, so we had plans to go to dinner after at Ruth's Chris. So I brought this fancy outfit dress with heels and stuff to go out afterwards. And when I got done, I was like, there's no way these feet are going into those shoes. So I actually went to dinner in my sweats with my medal.
Great.
And I didn't care.
That's awesome. Yeah. That's cool. I guess I didn't realize that you ran one.
I did. I finished it in
remember.
5 hours and 34 minutes.
Did you really?
I have the picture. Yeah.
Cool.
I haven't thought about that in a long time, but I do remember that you did that.
Yeah.
It was the same for me when I did my first bodybuilding competition. It was just like I could care less if I get a trophy or how I place or anything like that. I just want to be able to say I did it. You know, I went through the training. I got up there in my skivvies. I did my posing routine, and I did it. And so, but I'll tell you, once I got off the stage, and I said this is a one-time thing, you know, I'm just doing it just to say I did it. And then as soon as I did it, it was like once I knew, because now, like you, I went through that learning process of everything I had to do to make that happen. So now that I'd been through it, I was like, okay, now could I do it better next time? Because
Challenge
now I know
Yeah.
what I need to do and how I could do it even better. And then that's how you start getting hooked into this stuff doing it multiple times. So
Yeah, I'm curious to see if that ends up happening, because I had one of my other buddies that he was maybe thinking about coming. He lives in Michigan still, and he was thinking about coming out here and doing Chicago. And he's like, "Oh, I'll do it next year with you." And I was like, "I don't know if there's gonna be a next year.
Yeah.
Man. Like, this might be one and done." But also, I don't know. We'll see. I've enjoyed it enough to where I could see doing more of it, but we'll see. We'll see. I just want to get the finish line at this point. Right?
Well, good luck to you.
Thank you.
Yeah.
Thank you.
And for more details about his charity of the Special Olympics Chicago, we will post the link.
That's awesome. Yeah,
sure.
I appreciate that. Yeah, that has been very cool too to see how many people have donated to that already, and it's fantastic. It's such a good organization, so I appreciate any and all donations with that. That's huge.
would you mind me asking why you chose that particular charity?
There was a list of different ones that you could pick from, and as I was going through it, I don't know exactly. I think it just kind of called to me. I really like what they do. I have some friends who volunteer with Special Olympics and are different coaches, swim coaches, and things like that. And it's such a, I think it's a good organization. I think that the people that they take care of and work with, the different athletes, are amazing, are some of the greatest people. And so I think it was just one that as I was going through a list, I was scrolling down and saw it and was like, oh, yeah, I'm going to do that one. It just kind of jumped out to me. So,
Well, I have some friends who also who coach in the Special Olympics. I have friends who are teachers at a school for kids with special needs, and I have someone in my life who I'm very close with, who has competed in Special Olympics in the powerlifting for several years, and so it's a charity and a organization that I'm very, very attached to. So I appreciate that you're making that the one that you're raising money for.
Yep. Yeah. And we see so many people in our office that deal with various disabilities, and it seemed like an easy pick for me.
Yeah. Awesome.
Yeah.
Well, Dr. Mike, thank you for being here,
It's my pleasure.
sharing all of your knowledge with us. To find more details about Dr. Mike and the Neurologic Wellness Institute, you can make sure to check out their website. Do you have that website offhand?
Yep. It's the neurologicwellnessinstitute.com.
No.
Yep.
There you go.
Yeah.
Nice and easy.
Yep.
Thank you so much.
Thank you. Yep.
Yes, thank you again. You're a cool guy. You're very sharp.
Yeah.
I'm very impressed, and I could probably listen to you talk about this stuff for a few hours still.
I could probably talk about it for a few hours.
Will you be a guest again on our podcast?
Absolutely.
Okay,
I'd love
great.
to. I really appreciate, I'm humbled to be here. So yeah, thank you.
Awesome.
Well, thank you. Well, with that, as always, I, of course, have been who else but Tommy else.
And I am Andrea Trippi. And until the next time, here's to a healthier, more confident you.
The Trippy Coaching Podcast is produced and mixed by me. Who else but Tommy else? Theme song provided by Professor Click. Be sure to check him out at professorclick.com. All one word, KLIQ.com. The content provided in the Trippy Coaching Podcast is for informational purposes only and is not intended as a substitute for professional, medical, health, wellness advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Be sure to like, rate, and review the show, and you may hear your review read on a future episode. And follow the Trippy Coaching Podcast on Facebook for exclusive content.